Welcome everybody. My presentation is relationship of induced thyroid disorders and fertility in cyclic female rats. Okay, just I click this. Sorry, just I click this to move it. Okay. The aim of my study to investigate the relationship between thyroid disorders in case of hypothyroidism and hyperthyroidism and female reproductive fecundity in cyclic female rats. Hypothyroidism means decreased thyroid hormones, and hyperthyroidism increased thyroid hormones. We know that thyroid hormones have many metabolic functions, very important metabolic functions in the body. So any disturbance in thyroid hormones will affect many functions, many systems, including reproductive system. In our experiments, we choose 90 female rats, 30 we have induced hypothyroidism, and 30 hyperthyroidism, and 30 as a control. We have to induce hypothyroidism, 30 female rats were administered for 30 days by or with methimazole in drinking water. Hyperthyroidism have been induced by orally administered for 30 days of female rats with thyroxine, as well as intragastric gavage of thyroxine. Hypothyroidism and hyperthyroidism have been checked or by assessment of T3 and T4, triiodothyronine and tetraiodothyronine or thyroxine. This is the scale of experiment. After 30 days of administration and 2 executive estrous cycles, the results showed that body weight decreased in both groups, either hypothyroid females and hyperthyroid females. Also, ovarian weight also decreased. As you know, the ovary is the functional organ of the female reproductive system. TSH increased in hypo and decreased in hyper. Total thyroxine, free thyroxine, total T3, free T3, all of them decreased in hypo and increased in hyper. T3 to T4 ratio also increased in hypo and decreased in hyper. Hormone assessment, estradiol, the main female hormone, decreased in hypo and increased in hyper. FSH, follicle stimulating hormone, which is responsible for ovarian development and maturity of oocyte, also decreased in both groups. LH decreased in hypo and increased in hyper. Prolactin increased in hypo and decreased in hyper. Inhibin also decreased in both groups, whereas progesterone decreased in hypo and not changed in hyper. This figure shows the expression level of TSH, FSH beta, and LH beta genes. The gene increased of TSH increased in hypo and decreased significantly in hyper. FSH beta decreased in both groups in the 2 cycles, whereas LH beta decreased in hypo and increased in hyper in both cycles. This figure shows the expression level of pituitary genes, ovarian genes. Ovarian inhibin decrease in both groups. Aromatase decrease in both groups. fecB decrease in both groups, whereas thyroid receptors increase in hyper and decrease in hypo in both cycles. The remaining 10 females which matched with experienced female, this is control, normal number of liters per dam, whereas there is decrease in the delivered lethal in both groups. It means there is disturbance in the fecundity of hyperthyroid and hypothyroid female rats. This figure shows the tissue of ovaries. This is control. This of hypo and hyper. There is decrease in the number of primary, secondary, and mature follicles. In conclusion, thyroid dysfunction in both hypo and hyperthyroidism is associated with reproductive disorders in animals, including retardation in ovarian and female reproductive functions. Thank you very much. I'm sorry because this field is medical, not education. If anybody have any question, I'm ready.